Now, your health, your safety. This is ABC7 News.
Good afternoon, and thank you for joining us. I am Amadeus in for Kristen Z today. Every weekday at 3 o'clock, we bring you an expert who can answer all your questions in real time. And you can submit a question by commenting on our Facebook live stream, YouTube Live, or responding in our Instagram stories. Today, we have our special correspondent, Dr. Alok Patel. He is often with us. We do not take breaks online. That's another thing you should know about this show. So you'll get extra content and a look behind the scenes during the television breaks. We are also keeping an eye on a news conference in San Francisco. San Francisco supervisors are expected to call on the city to take action after the first confirmed case of COVID-19 was discovered in a homeless shelter. This is where the news conference is going to be. You can see we are all set up there. We will take you to it just as soon as that happens. All right, so first we want to welcome Dr. Alok Patel. Hello there, doctor. Good afternoon.
Thank you. Thank you. I appreciate being here.
Yeah, good to see you as always. First, I want to get to something immediately I heard today. People are now again talking about the fact that they could possibly get COVID-19 just from breathing air that someone who had it was recently in. Is that true? Have we learned anything new?
Well, what we're suspecting, and this is according to the National Academy of Sciences, and this falls in line with kind of realizing that asymptomatic spread is actually a large player here, is that people who have the virus may be able to spread those little respiratory droplets simply from talking or breathing. And so every time you open your mouth and you talk or breathe, you could be shedding a little piece of virus that somebody could potentially get. Now that's concerning, and that kind of falls in line with wondering if people are out there without overt symptoms and are still spreading it, and this could be a reason why.
Oh, okay, so that's interesting. So it's not necessarily like it's actually airborne like measles then?
So two different things, because what they're talking about is that they could be actually spreading viral particles. The airborne concept has been looked at in the lab, and what they found is that in an aerosolized environment, the virus actually was able to survive for several hours. So in theory, if you were to breathe out a lot of this virus or cough or sneeze or something, and somebody was in the same airspace, even after you left, they still might be able to get it. But here's the thing that people need to understand. When you're coughing out viruses, it could be alongside mucus or a respiratory droplet or saliva, and it may not be able to hang out in the air. It may fall on the ground. But again, these are all unknowns, which is why we're just really having to be very careful about people going outside, physical distancing, careful about crowded areas, and or if you're in a place with poor ventilation.
Okay, but for doctors like you, there are certain procedures that can make it like an aerosol, like intubation and such, correct?
And that's exactly why the N95 masks have to be reserved for the healthcare setting. Because you said it perfectly. In the medical setting, we're doing aerosolizing procedures, meaning intubation is a great example. And when you're that close to a patient's airway and they're coughing things up, you're right in that space where there's a large amount of virus coming out. And so when you're that close with someone who has the virus, or you're taking care of someone who has the virus, you're at increased risk.
Yeah, absolutely. And that's why we see the medical professionals always wearing the masks, even though most of us hadn't been wearing the masks. Let's get to some of the questions. We'll talk more about masks in a minute. First, let's start with Instagram. A question came in. Are we really close to flattening the curve? Because people are wanting to know if this lockdown is going to go past May 3rd.
I wish we had a close answer to that. Now, the reason why it's really difficult to say, again, is because we still see numbers rising. Now, in some parts of the country and in the world, those numbers are slowing. So it's possible we might be hitting the apex.
Okay,
but it
Dr.
all
Alok,
depends on the
Dr.
region.
Patel,
You know,
I hate to interrupt you. We're going to get right
Yes,
back
ma'am.
to that, but we are getting that news conference right now out of San Francisco. So we are going to switch to that
That's
right
important.
now.
That's important. We got to
it
hear
is.
that.
So we'll get back to you. Let's dip into the news
navigation
conference.
Centers, that it is time that we speak out publicly about our city policy around people experiencing homelessness during the COVID-19 crisis. We received news today that for the first time that we know of, someone tested positive who was sleeping behind me at the Division Circle Navigation Center. For the past 4 weeks, the 5 of us as supervisors and Jennifer Friedenbach, the executive director of the Coalition on Homelessness, has been talking to the Department of Public Health, to the Department of Human Services, to the mayor's office, and saying, from a common sense perspective and from a health perspective, we need to house in hotels, in some of the 30,000 plus hotels that are sitting empty as we speak, people experiencing homelessness, if they can take care of themselves in the hotel, if they don't need supervision 24 hours a day. We have the hotel rooms, we have the money, we have the staffing. Why wouldn't we do this? Why wouldn't we do this right now and save thousands of lives? For 4 weeks behind the scenes, we have been advocating every single day to do what can only be called common sense. And we have been given every excuse in the book about why this isn't possible. Well, we are here to say this is possible, and we are not going to take no for an answer. This morning, we demanded that everyone from the shelter who has been exposed to COVID-19 be housed in a hotel room if they can take care of themselves. We were told that that is not going to happen, that they will move people that were sleeping closest to the individual, but that they weren't even ready to move 60-year-olds or people with serious underlying health conditions. We know that there are at least 75 individuals who are over 60 or who have serious underlying health conditions that have been guests in the Division Circle Hotel and must be moved today. Supervisor Peskin will share with you a conversation he had with the mayor a half an hour ago. It appears that they are going to move individuals that are older or have health conditions by the end of the day, but not everybody in that navigation center. And what we're here to say is that is simply unacceptable. This is my district. That navigation center sits in my district, and I will fight to get every one of those residents, like all of my constituents, inside, sheltering in place and safe. Once again, we have the hotel rooms, we have the money, we have the staffing. We can fight for more money from the feds if we can't pay for it all at once. Why aren't we doing what makes sense and saving lives by housing every single homeless individual who can shelter in place and self-care? There is no reason and no excuse why we cannot be doing that. I will now turn it over to the executive director. Sure. My name is Hillary Ronen, Hillary Ronen. I am the supervisor of District 9, where we are standing right now. We called it collectively. The 5 of us supervisors, Supervisor Aaron Peskin, myself, Shaman Walton, Matt Haney, and Dean Preston, who is on his way, have been fighting and making this very demand for the past 4 weeks. We think we've gotten somewhere, and then we move way backwards. We think we've gotten somewhere, and then we move way backwards. So we are now taking this fight public, and we will explain all the steps that we are going to do in order to do that. We're going to introduce emergency legislation that my colleagues will talk about shortly. But first, we're going to introduce the executive director of the Coalition on Homelessness, Jennifer Friedenbach.
All right, and you are listening to a news conference that is happening in San Francisco about a person who tested positive in the Division Circle Navigation Center, and they're talking about hopefully moving people who are in that center and are at risk of potentially contracting COVID-19 to hotels. The supervisor, Hillary Ronen, you saw there saying that the city has the hotel rooms to move those people, if they can take care of themselves, to those rooms so that they can shelter in place there. We will continue to monitor that and always have the latest info on ABC7news.com. For now, we are going to take a quick break, and we will have more questions with Dr. Patel right after that break.
We're in commercial break. We can talk to Dr. Patel.
Okay, so if you're still with us online, Dr. Patel, are you still with me? Good to see you.
Hello, Facebook.
Hello. Okay, so, well, that's interesting. I don't know if you were able to hear part of that news conference about the person who tested positive at the navigation center. San Francisco has tried so hard to get homeless people, people who don't have a place to go, into these centers, but now you have the people in the centers and someone has tested positive, so now they're trying to get everyone out. And that's why it's so important for everyone else to shelter in place, correct?
Absolutely. And this kind of taps into something that's a social determinant of health. So we say things like, go see your doctor, but not everyone has health insurance. We say things like, stay at home, shelter in place, physical distance, but not everyone actually has the option to be able to do that. It's not only people in homeless shelters, people in nursing homes, it's a lot of refugees as well, prisons. Like there's certain situations in this country that are at increased risk no matter what they do. And so we're looking out for them as well. We have to be.
Yeah, absolutely. So let's go back to the question we were talking about before we went to the news conference. We don't know yet if we're flattening the curve because we're sort of still at an elevated state with the numbers that we're seeing.
Well, it really depends on where we're looking in the country. There's models coming out saying that, on the West Coast, some cities could hit their apex later on in April. And, that would not be us really flattening the curve. That'd be us still kind of rising in it. And one big variable that we're missing right now is how many cases are out there. Because, again, we still have a huge lack of testing right now. We even have a backlog of testing. Right. And so it's really hard to predict where we're at in the curve until we can actually see how we're doing in controlling the spread.
Okay, so we are going to come back out on TV, so give us a quick second, Doctor. All right, we are back with special correspondent Dr. Alok Patel. So would you be surprised if our shelter in place went longer than May 3rd?
Not at all. I wouldn't be. We know that is the right thing to do. We have about 92% of this country right now under stay-at-home orders, and we really need to have a unified rule to shelter in place. And again, like we mentioned, we're not sure if the curve is flattened yet. So I think the best thing is that we can do is just prepare for the fact that this might extend well past May. There's some models predicting that we're going to still see cases going through June or July. And the best thing we can do is we have tools to mitigate, and we can just really make sure that we're all working on this together, regardless of how long this goes.
Okay, next question. Can you talk about any new symptoms that you're seeing? I've seen some people talk about possibly GI symptoms before everything else hits.
There's a lot of reports coming out about kind of atypical symptoms. Now, again, your classical triad is going to be what people have been talking about with the dry cough, fever, and the shortness of breath. But there's reports about patients presenting just with stomach symptoms, with nausea, loss of appetite, or diarrhea. The receptor that the virus uses to latch on to your respiratory system, that receptor, it's on the outside of cells, is also found in your stomach, on your blood vessels, even parts of your central nervous system. So we've seen patients in literature that have presented with diarrhea. We've also seen patients present with things like confusion, headache, strokes. So what it tells us is that we just have to make sure we keep a very broad lens out when we're seeing patients who are not presenting like a typical COVID-19 patient.
Okay, and that was another question. What are some of the rare symptoms, and if diarrhea is a symptom? And it sounds like they can be, but that's more rare, along with the headaches and things like that.
So far, and what it's just telling us to do, again, is that we just have to make sure we keep a very open mind when we see these patients. But one other symptom, which isn't necessarily rare, because it's being reported a lot, is that loss of smell or taste. Now, there's an app, a COVID-19 symptom tracker app, where people can report their symptoms, and they had a very large amount of people, according to a New York Times article, actually report having a loss of smell or taste. So again, we're learning more and more as the weeks go on.
Yeah, and in fact, our coworker whose wife tested positive, she had mentioned having that as one of the first symptoms. So the next question, we touched on this briefly. When can we expect more testing kits? Someone feels that so many cases are going unreported, and like you said, we still need more kits, right?
Yeah, and I don't know yet if we have a specific date that we're going to be able to say, hey, now we have more tests, because it depends on where in the supply chain we're talking about. Now, about a month ago, we were talking about issues with the actual chemicals needed to run the tests. And that's when Governor Newsom made that famous quote about saying, this is like getting a printer with no ink cartridge. And now, fortunately, private companies have been stepping up and have been trying to start mass producing tests. We still have a national backlog of these tests. One thing that is hopeful is the FDA just approved a new type of test, different than the one that we're using in the past, kind of an antibody test. So hopefully that will also contribute to what we're doing right now and just trying to get more screening out there and trying to figure out if someone has COVID-19, if someone doesn't, if someone's improving, etc.
All right, good to know. All right, so Coco wants to know, can you catch this virus from packages in the mail?
Great question, Coco. So we have mentioned before that we suspect the virus can live on cardboard for about a day. Now, if you think about the mail, that is likely traveling to different distances. It's not really going to live that long on paper. And also, when in doubt, always just wash your hands. Now, one thing that we should always remember is even if there's a little bit of virus on something, that doesn't necessarily mean it's going to be enough to cause a rapid infection, but we can't say otherwise. So when in doubt, just wash your hands, but it is still absolutely safe to get your mail.
All right, we may be able to get one in before the next break. Mandy asks, how do essential businesses do symptom checks?
What we're hearing is that businesses are being very strict about screening their employees and making sure they have no recent symptoms, travel exposures, etc. Now, the kind of twist here, again, is we talk about that asymptomatic spread and the fact that an employee could have no fevers, no cold symptoms, and still actually spread it, which is why I will not be surprised at all if the CDC recommends that people working in certain industries will start wearing masks even if they're not sick. So I'm talking about the post office, certain essential businesses, grocery stores, all that, just to keep that extra barrier of safety.
Well, and especially this time of year, we're in April now. A lot of people have allergies. Sometimes you get a headache from that, and it's just hard to know what's going on.
It is. I have seasonal allergies. My eyes are itching right now. And that could be alarming for people. We've even seen a case of pink eye. And that actually was COVID-19. And so we just have to make sure you take your symptoms into context.
Okay, yeah. I told my husband I've never been so scared of catching a cold. All right, we're going to take a quick break, so stay with us. We're answering more questions on our live streams. You can still join. We're on Facebook Live, YouTube Live, and our app. But on air here, we're going to take a quick break. All right, all right, doctor, let's go on to the next one. Oh, this is an important one. I may want to ask this when we come back on air, too. Are you able to get the virus a second time if you've already had or recovered from it? I know a lot of people want to know that answer, excuse me.
Based on everything we know, the answer is no. So based on all the reports we have not seen somebody have a confirmed infection, then confirmed negative, and then get it again. Now, there are some cases where there was kind of a discrepancy in the tests, and what scientists believe is that it was actually an error in the testing, and not that someone got it twice. Our understanding right now is your immune system should build antibodies against it, and you should be immune to it. But again, things could change.
So that makes me ask, I don't quite remember the testing. How accurate are the tests? What's the margin of error?
It really depends. So it really depends on what types of tests we're looking at, where they're being run. We mentioned the chemical reagents. The first tests we were using here in February, they were faulty. And so there was a false negative or a false positive rate. And so that's why these tests have to be taken into context with kind of the clinical scenario. The new tests coming out are promising to be a lot more sensitive and, really picking this up. But one of the gold standards for making sure somebody is negative is to test them twice, just to make sure. So one negative test, 24 hours later, another negative test. That's where we want to get.
Okay, and that new test could be a little more accurate, perhaps? The one with the antibodies you were mentioning?
I'm not sure if it could be more accurate, but definitely now that it's been FDA approved, they'll start to study it.
Okay.
And the science behind it does sound like it could be more accurate.
Okay. All right. Hang with us. We're going back on air. Okay, we are back with special correspondent Dr. Alok Patel. So we want to go back to this question we just answered for all of our Facebook Live friends. Are you able to get the virus a second time if you have already had or recovered from it? Viewer Anna is asking this question. I think we all want to know this.
So the expert opinion right now is that we do not believe you can get it twice. Most experts believe that your immune system will kind of build antibodies against it and you'll be protected from getting it again because it's the same virus. Now, there are reports of people testing positive and then negative and then positive again. or testing negative and then positive. We think that that's actually an error in the test and not because they were, had COVID-19, then recovered and got it again.
Is this the same with the other viruses in this coronavirus family? Usually you only get it once?
Typically, yeah. So typically you're going to build immunity against one specific virus strain. Now, the caveat is there are hundreds of respiratory viruses out there, which is why people continue to get common colds.
Right, yeah. Okay, so the mask debate, let's get to that. It's one of the biggest conversations happening right now. Here's a question from Instagram. Should healthy people be wearing a mask? If so, are homemade masks just as good? These are two sort of separate, very important questions. So let's start with, should people at home be wearing masks?
This is a tough one, and there's a reason why there's such a big debate here. Now, if you are healthy and you have no symptoms, it is not a bad thing to wear a cloth mask. If you're going to go into a place where you might encounter somebody within an enclosed space or a place with poor ventilation. Now, I say this with such a caveat because if you really are sheltering in place, you're keeping that physical distance, and you're healthy and you're not around a high-risk patient or someone with COVID-19, you shouldn't need a mask. But we were talking about people in grocery stores, people when they're commuting. There's certain situations where wearing a mask might actually prevent someone from sharing those respiratory droplets, or even the droplets when they're talking or they're coughing, even if they don't have symptoms. But I just have to stress, regardless of what the national recommendation is, we have to always make sure the medical grade masks, the N95s, are reserved for frontline healthcare providers.
Okay, so that
we cannot see another hoarding incident like we did with toilet paper.
Absolutely. But that makes me think, though, that the homemade masks probably aren't quite as good, but could still perhaps serve a purpose?
And that's absolutely right. So two things we look at when it comes to a homemade mask is filtration. So that is the actual fabric you're using. You have to be able to breathe through it, but it has to actually function to block some of the particles. And then it actually has to fit. You want a decent fit. And so some of the do-it-yourself tutorials online try to account for both of these. They use things like a pillowcase or a woven cotton t-shirt, for example, with a little bit of elastic or ribbon. These all work perfectly fine. Again, they're not going to be at the same high level as a PPE that you use in the hospital, but they don't need to be. What I want people to understand, and this is not meant to sound dramatic, for every N95 that is not given to a frontline healthcare provider, that's a potential life that's at risk, either by a medical professional or a patient. So that's why we say if it's a do-it-yourself mask, you're keeping it clean, you're washing your hands, you're not touching your face, more power to you.
Okay, so we have about a minute before the next commercial break. How do you sterilize a mask after you've worn it? Do you just spray Lysol on it? I mean, I don't know what you do. Do you wash it if it's a cloth one, I assume?
I think some of the people who are crafty might have a better answer than I do, but it depends on the material. Okay. And for example, if you had a cloth mask, it's the same thing as a cloth tissue. If you get it wet, if you cough on it, a dirty mask may be more dangerous than a clean one. Now remember, a mask is not a replacement at all for the recommendations happening right now, the sheltering in place, the physical distance. It's just an adjunct. It's an extra tool.
Right. All together. Okay, how about this question? Hospitals in England, we have about 30 seconds for this one. Hospitals in England are already mandating doctors shave off their facial hair. Would they do that here?
I've heard of it happening in some institutions here, and I've had a couple of colleagues report this, and the reason why is because excess facial hair might actually impede the way an N95 fits. It has to fit snugly around the face. And actually, when any healthcare professional, including myself, gets an N95, we go and get fitted to make sure we have the right size. And so if you have facial hair and you don't want to shave it for whatever reason, there are other types of masks they can use. But I haven't heard it being mandated here, but I've heard of it happening. I've heard of physicians on their own electively doing it, or their hospital administrators or supervisors asking them to for safety.
Okay, interesting. All right, stay with us. We have a few more questions left with Dr. Patel. You can join us on our live streams. We will be right back on TV. Okay, so are we on break?
Now we're on break.
Okay, now we're on break. So Dr. Patel, that's interesting because I was assuming things could stick to the facial hairs and that was the reason they were maybe mandating people shave, but it's actually the fit of the mask?
So again, I can't speak to what they're doing in England, but over here, the colleagues I've spoken to, when it comes to their facial hair, it really is the fit of the mask. Now, I'm going to be honest with you. I do not know a single emergency medicine doctor on the front line with like a Santa Claus beard. I don't think that exists. But there are other types of facial coverings. There's other types of over-the-head masks that someone could use in that situation if it were to arise.
Okay, so Brenda wants to know, if you get COVID-19, quarantine for 2 weeks, then what? It goes away and you're okay? I mean, we kind of touched on that. Hopefully you can't get it again, but that's her question.
What we hope is that over time, even if you still have a little bit of virus in your body, the viral load, we call it, will drop down to a really low amount where you may not be as contagious as before, if that makes any sense. Now, in a perfect world, you would be able to go and get a test, and your test would say you're negative, and then you would get another one and say you're negative, and then you'd be free to, resume your normal life. But just because we don't know right now how long you could be contagious for after your symptoms, and we don't have enough testing to actually declare that, we're just urging that people have to still maintain that that self-quarantine, that sheltering in place.
Yeah, definitely.
And that's part of why this deadline might be getting extended.
Okay. Are you most contagious in the beginning before you get symptoms, and then when you have the symptoms?
10 seconds.
Oh, we have 10 seconds.
So you have to think about again.
So
you have to think about how
hold on
you're
1
spreading
second.
it.
We're
So it's
gonna come
usually
back
going to be
on
a couple
TV.
days before, or let's do it.
Okay, we are back with special correspondent Dr. Alok Patel. And actually, let's get on to the next. Well, I wanted to ask you, I was asking you during the break, are you most contagious if you have COVID-19 before your symptoms show up, and when you have symptoms, then after?
Now, I'm not positive that we have a defined rule about when people are their most contagious. There's accounts of people that they call super spreaders who are more contagious than others, but that didn't necessarily correlate with them having really big symptoms. And so, an educated guess would be that if you are coughing, if you're sneezing and you're spreading a lot of virus, you would be more contagious than if you weren't actually shedding that much particle. But there are case reports of people being contagious even before symptoms started.
Right. Okay, so we have maybe a little over a minute, maybe 2 minutes left, so let's get a couple rapid fire in here. Someone wants to know, are people with type A blood more likely to suffer from COVID-19?
And I understand where that question is coming from. There was a study in China, and they found that people with type A blood had a little bit higher of a risk of getting COVID-19. Here's the problem. That was a small study. It has not been peer reviewed, meaning it hasn't been evaluated by the scientific community. And also, if you look at those numbers, there was a variation in the amount of blood types, and every blood type was still catching it. So I would not worry about your blood type at this time, but it's definitely a topic just based on blood types and genetics that scientists are going to keep exploring and basically review that study and look to see if they can replicate it.
Okay, can you get it from a mosquito?
Not yet. Sorry, whoa, not yet. No, you cannot get it from a mosquito. Sorry.
Okay, thanks for clarifying. 30 seconds. Does getting the flu shot help?
Getting the flu shot would help you from having the flu and COVID-19 at the same time, which would not be a good thing. But the flu shot does not have protection against this virus. It's a different virus than influenza.
Okay. Oh, I'm told we have time for one more question. How long do you have to wash your clothes if you've been around someone with COVID-19? How long do you have to wash your clothes for?
We usually just say a routine wash cycle. Just a routine wash cycle with laundry detergent should handle it.
Okay.
But it's a good question because people who are out and about may get the droplets on their clothes, and so changing your clothes outside your front door, in the garage, whatever, and washing them is a good idea when in doubt.
Yeah, especially since all of our essential workers are out and then they come home to their families. So thank you so much for joining us. We appreciate it. Dr. Patel, we always love chatting with you and getting all the answers to everyone's questions. We'd like to thank everyone at home for joining us for this new experimental interactive show. We're going to be here every day at 3 o'clock. on air and on live stream, answering your questions just like we did today. We had so many great ones. So you can check us out on Facebook Live, YouTube Live, ABC7news.com, and of course our app. And we're tracking the questions that weren't answered today, and we will save them for our next expert. So don't worry, we're going to get your questions asked. And join us in 30 minutes for a special town hall as ABC7 confronts hate crimes against Asian Americans during the pandemic. Am I really off? Or am I on social media? Okay. All right. Thank you, Eric, for a welcome.